Hi, mine's David Cumming. I'm a spinal surgeon in Ipswich. I hope you enjoyed our webinar last week. So my case was looking at back pain, and the CT scan you can see shows a lytic spondyolysthesis. This is a very common condition. Roughly 8% of the population have this, and it's one of the most common conditions that we see as spinal surgeons. So initially, there was questions around what investigations we should do. So most of these patients will have already had an MRI scan when they come and see us. I would then do a CT scan to look at the pars defect and define it in more detail. And then following that, there's not many more investigations I would tend to do. I would then move on to treatment plan, where I would normally do an injection as a diagnostic test, but also to give some therapeutic benefit and see what effect that's had. The initial treatment for most of these patients will be to treat these patients conservatively with good physiotherapy, core strengthening exercises, and analgesics as required, and really modifying activities. In the longer term, a lot of these patients do develop not only back pain, but also develop some radicular pain, and this tends to be around the L5-S1 level, and this is where the L5 nerve roots will be affected. If this is the case, then again, we can try some injections with some nerve root blocks and pars injections. If this fails, and we failed all conservative measures, then I would move on to a fusion operation where you could fuse that segment. Now, there's lots of ways of doing a fusion. You could do it from the anterior approach with posterior screws to augment it, or you can do it from a posterior approach only with fixation in situ, or with an interbody cage in the way of a transforaminal lumbar interbody fusion. Now, in the younger age group, you do get pars defects, especially in young sports people who do gymnastics, cricket, and these patients quite often have very acute pain with a lot of spasm. Initially, we would treat these patients conservatively, tell them to stop playing sports, modify their activities, take simple analgesics, and see if that pars defect will heal. If it doesn't heal in the longer term, or they're unable to return to normal activities, then we can look at doing a pars repair if there is no slippage, and repair that pars defect directly. But then we would also have to limit their activities for a period of time afterwards to allow this to heal. I hope that's been useful, and we'll be doing further webinars in the future, and I hope you've enjoyed the spine webinar. Thank you very much.